Consideration is vascular activity. There are no blood vessels in the epidermis. So any condition that you treat within the epidermis, which is going to include acne, hyperpigmentation, hypopigmentation, milia, no blood. So if your needles are working on stratum corneum, your visual endpoint will be no blood, but also no color change. Realistically, nothing is going to happen. If your needles are working in granulosum, you're going to increase the inflammatory response a little bit farther. So this is going to look like no blood, pink skin. Advantageous for milia, advantageous for comedonal acne, but it's still too superficial if you're wanting to treat hyper or hypopigmentation. So to indicate that you're working in basal and spinosum, your response will be no blood, red skin. Whilst there are no blood vessels in the epidermis, there are blood vessels in the dermis and also in the hypodermis. Those vessels in the dermis are particularly concentrated around papillary dermis, and they are more frequent and smaller in size by comparison to the vessels that we find in the hypodermis. You'll also notice that the epidermal junction is characterized by these fibrils or finger-like projections, which rise up out of the dermis and then connect the epidermis together. So with these fibrils, they're not too dissimilar to pieces of puzzle that you can see there are horizontal vessels here, but these small vertical vessels rising up the fibrils. To indicate your success for treatment of dermal hyperpigmentation, mixed hyperpigmentation, you need to be targeting the clusters of melanophages, which tend to cluster around these vertical vessels. So your visual endpoint in this case is going to be the occasional pinpoint blood, particularly where we see these vertical vessels rise up the fibrils. But for collagen induction therapy, it's too superficial. Your visual sign that you are working directly into mid-papillary dermis and beyond is going to be the sign of consistent pinpoint blood. There is no such thing as a baby DP4 procedure. You either hit the cell that's malfunctioning and achieve your biological regenerative response with success, or you don't, and nothing's going to happen. So for your collagen induction therapy procedures, it's going to be here. Your anti-aging, here. This is too deep for pigmentation, too deep for acne. So the next consideration is working down to hypodermis. Because the vessels are larger in size, but less frequent by comparison to the vessels in papillary dermis, your visual endpoint is going to be a moderate release of blood. So with this, we now actually use what you see, what you identify to create pinpoint precision for every patient every time, not what you dial up on your device. So we don't preset the device to say 1.5 for anti-aging. We don't assume that all scars are 3 millimeters. What we do is assess which indication do we have. Number 2, what's the pathophysiology? Which cells are malfunctioning? Number 3, where are they located within the skin? And number 4, how does that relate into my visual endpoint? Is it going to be no blood, no color change? Is it going to be no blood pink, no blood red, the occasional pinpoint blood, consistent pinpoint blood? Or alternatively, is it going to be a moderate release of blood? So we now use this to open up new opportunities of treatment, understanding that depth is not mathematical. If you want to see pinpoint blood and you don't, increase your needle depth. If you want to see no blood, red skin, but you see blood, decrease your needle depth. So now you can truly customize for every patient, for every region, for every procedure, every time.